Sometimes it does. Hello, everybody. I'm Pamela Coons. Welcome to Health and Wellness Today. My name is Pamela Coons. I said that already. Stephanie Pollard, who is a community health educator and a research scientist, who is going to be having a regular show on At the Wellness Network. Stephanie, I really appreciate you stopping by the studio today, and just kind of impromptu, we decided to do this show to talk about a couple of things. One, the debilitating effects of arthritis, what people should be looking for, how treatments are available, and even some home remedies, what you need to know even when you're talking to, hi, Cody. Cody is a massage therapist here in Gainesville. Fantastic one, I understand, Cody. Hope you're doing well. And you probably could do something to help arthritis as well. So Stephanie, first of all, welcome to the At the Wellness Network family.
Thank you.
Yay. So this show will also, you're going to be hearing this when you tune in to At the Wellness Radio TV, our internet station. So those who are listening on the radio station, who are listening to this show being replayed, hi Brenda Mosley. And when I'm talking to people, it's because I'm talking to them on Facebook. But you can hear this show and many other shows in their entirety. My sister Frances in Harvest, Alabama, how you doing? So Stephanie, first of all, let's talk about what is arthritis. What's the difference between, there's arthritis and then there is, what's the other thing with the joint pains?
Well, all of it is kind of wrapped around arthritis in the sense that your joints are inflamed. And when the joints are inflamed, they're just not moving properly like they should. And you have what we call synovial fluid, and that's the fluid that makes your joints move back and forth like they should, like they shouldn't be stiff. And so we got a couple things. Sometimes that fluid may reduce, and so that fluid being reduced doesn't allow for the movement of the joints to move like they should. And then also...
Wait, Stephanie, we're talking about rheumatoid arthritis, which is very debilitating. Hello, Catherine Marshall. You can't hear us? I can't hear you. Which one you can't hear, Francis? You can't hear both of us, either one of us? Or you can't hear Stephanie? Because we tested the mics before we went on. That's the beauty of live.
Hello, can you hear? Hello? Let's see.
So when you're talking about fluids, if you can't hear me, please let me know. I can hear very well. So Francis, maybe there's something wrong with your phone. Thank you, my sister. Isn't that wonderful? This is my sister Catherine in Chicago, Belleville, Illinois, and then my sister Frances in Harvest, Alabama.
Okay.
Isn't that nice? Hey, Ken, folks. So, hi, Miss Reed. Stephanie and Thelma Rudd in Memphis, Tennessee. Hi, Thelma. Stephanie is a research scientist and a health educator. We're talking about rheumatoid arthritis, the stiffness in your joints, and the fluid. Talk about that fluid, because I got a little soreness in this finger right here.
It's called synovial fluid, and that's the fluid that's in between all of your joints, because your joints have cartilage, and that's that smoothness or shininess that's especially like you see in your knees, that makes your knees go back and forth, your elbows. And so that fluid is kind of viscous and a little bit thick, just because you need that to make it move back and forth like it should. Now, there's two things that can occur. Sometimes that fluid gets an infection, and you get bacteria in that fluid. And when that happens, you'll see inflammation. And inflammation of the, particularly the knees. And when that happens, the physician will take off some of that fluid. He or she will send it to the laboratory. We'll do some testing on it, and one of the tests we'll look at it under the microscope, and you can physically see if there's any bacteria in there. And then if it is any bacteria, then they'll send that off to microbiology, and then they'll identify what that bacteria is, and then a physician will already give you an antibiotic to start the process.
Yeah. Stephanie, you're talking about the fluid in the joint can have bacteria in it.
Yeah.
And that's where that soreness and stiffness comes from, and the tissues get inflamed.
Yes.
And we think about it more because we see it, and that's my other sister. That's Sharon in New Jersey.
Can she hear us?
Sharon, you can hear okay? Because Frances was having trouble hearing. I think she says it's her phone. Catherine is watching in Chicago. And we're talking about arthritis. So this fluid can get infected. So this finger here is tender. Fluid can be infected. I didn't realize that. Infection in the fluid.
It can get infection in the fluid. The fluid can reduce, like it's not as much as it should be.
So you need to hydrate.
And you need to hydrate. And then just your body, as we age, you know, our muscles, our ligaments are just not the same, and they become inflamed. And so when the ligaments become inflamed, then that's going to cause the stiffness. Also, with our weather, when it goes from hot to cold, that affects it because you got that, what I call contraction, and it reducing back and forth. And so sometimes you'll have that achiness when you have that cold weather. And so there's some home remedies that you can do using Tagamet, which is like icy hot, Bengay. And now they have Bengay where it doesn't make that loud smell. Some people don't want to, everybody know they got arthritis. And they even have,
But when you get some relief, that's what you want, is some relief. So you probably, if you're hurting bad enough, you're not worried about
you'll
what they
put
say.
it on there.
That's right. So these home remedies, and then there's some other things. You talk about humidifiers that people can have in the house.
Well, now we'll use humidifiers when, especially when we're going to the cold and hot, your sinuses. So we got our two things going on. And all of it's related with fluids because your sinuses, that's fluid getting inflamed. Once again, you may have some bacteria in that sinus fluid, and it's the same methodology. If you got bacteria in that sinus fluid, it's going to cause inflammation.
And that can contribute to arthritis?
No. We got two different things.
Okay,
but we got it's fluid. It's the methodology, meaning that the same method of that inflammation that's in your knee with bacteria being into that fluid. If you have bacteria in your sinuses, that fluid is going to cause inflammation all up in here in your sinuses. You're not going to be able to breathe properly. It's also going to cause you a problem when you're trying to sleep. And once again, if the doctor deems fit, he or she may or may not give you antibiotics, but you'll need to do some home remedies. And so to do some home remedies for the sinuses, you can do one or two things. You can get a humidifier. You can put some Vicks in there. If you don't have a humidifier, you can get a pot of water, put it on, and put, even if you have like peppermint oil, put it in there. Just something that warms up the environment and makes it moist.
Yeah. Sharon, I know you like drinking ginger tea this time of year, so we're talking about arthritis as well as this
Sinuses.
Weather shift and with the sinus, because here in Florida, in Gainesville, Florida, yesterday it was like 82, 83 degrees, and now today it's dropping
down to, it's about 60 now, and it's dropping.
Yeah, and so when I got out of the car, I was like, ooh, this feels, as Mo would say, this is the kind of weather that make you sick. That's what we call my mama.
Yeah.
And because of the temperature shifts. Now, for those of you who are already in cold weather and having to deal with the potential upper respiratory issues, that's what you're talking about, is keeping those sinuses well humidified.
And have some type of what I call methylatum type of, or peppermint type of moisture fragrance in the moisture, because that just helps open up everything. Because what ends up happening when your sinuses swell up, now you're not able to breathe properly in and out, and then it seems to be sometimes worse at night.
Oh,
So
it is
now,
for me.
now you got two things going on. You're not able to breathe properly at night, and then you're not sleeping.
Right, right.
And so it's a catch-22, because if you don't sleep well at night, then that brings on a whole nother thing of you're tired.
Mm-hmm.
Your body has not had a chance to relax, because when you're sleeping at night, that's when your body repairs itself. That is the time of repairing. That's what we call that REM sleep, that deep sleep. That is the time when your body is just repairing everything that it's been beat up with throughout the day. Because throughout the whole day, your body is fighting off all kinds of things that's in the air, that's in your environment, the stresses that you come through.
Yeah, which we're talking to Stephanie Pollard, who is a health educator, and Sharon is giving her information for using Ginger. Hi, Leah and Alan Marshall Jr. Hope you had a great birthday, Alan. But that's why we sleep so much when we get sick, because our body is not going to let you do anything else.
It needs to repair itself. It's like you're at the mechanic. When you go to the when you go to take your car to the mechanic and you say, "Hey, my engine is not acting right, or it's making this tick 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 noise," the mechanic goes in there and figures out where the tick 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 is coming from. And so at night, when you go to sleep and you go into your REM deep sleep, that's your mechanic. Your body is like fixing all those little things that's been going on throughout the day. It gives your brain a chance to relax and not have to figure out 500 different types of things and what you need to do and where you need to be. It gives your brain a chance to just relax, and then just allows your body to repair itself.
So we're talking about arthritis as well as sinuses for this time of year, because this is the season where we get the upper respiratory issues. This is the season where our joints start to feel a little stiff and sore, and arthritis can be all over the body. In the spine. We often can see the symptoms. Hello, Louise McKinney. We often see the disfiguration in joints in hands and feet as a result of that. What is it that people can do? Oh, one more thing. What are some of the treatments that you may be getting from the doctor that could upset other things in your body that you need to look at for arthritis?
Well, one of the things, sometimes the physician may prescribe steroids. And I caution this to anyone that is taking steroids. One of the two big things that steroids do is it increases your blood sugar, even if you're not diabetic. That's just a side effect of it. It increases your blood sugar, and it also can make your blood pressure go up. So it is important to get that information from your physician and keep a close eye on your blood sugar. Because I know of a young lady that was put on steroids for a respiratory issue that I think she had emphysema. And so they gave her prednisone, which is a pretty high potent steroid. And she did not know about the side effect of the blood sugar. And she was at work and fainted.
Really?
When she went to the emergency room, they took her blood sugar and it was like 400.
Really?
Yes.
And let me tell you, I've been on prednisone, and usually when you get your dose of prednisone, they taper you off. Well, they didn't give me a prescription that tapered me off, and it can have some real powerful effects on you, just dropping you off a powerful steroid like prednisone. So our goal with Health and Wellness Today, that Stephanie will be a regular part of, is to give you information so that you know more about this vessel, your body, so that when you're going to your doctor, your holistic practitioner, whoever it is, that you have the information.
Have that conversation, because what I'm getting feedback on, people are not having that conversation with whomever they're going to, their healthcare provider. Have that conversation, not just hold that stuff in and then try to figure it out yourself. That's
when you
the
get
whole
home.
Have the conversation. I mean, we as a people, we have to start talking about what's going on with our body and have that conversation with our healthcare provider so that we can get that information and be empowered. And there's several options. And sometimes if you feel like the healthcare provider that you have is not answering the questions in the way that you feel like you should be getting a response, sometimes you may need to look at a second opinion.
Well, and hi, Mary Lynn Joseph. Stephanie, we can talk. We can do a whole show on that. But how empower people, help people to understand that ultimately, no one is as responsible for this body as you.
Yes.
And nobody's going to care as much about it as you.
Exactly.
So if you are uncomfortable with somebody doing anything to you, you have the right to step back.
Yes. And address it. And if you feel like your questions are not being answered properly, or you have come 2 or 3 times about the same issue. I'll give an example. If my ear is ringing, say the doctor gave me a medication, and my ear is ringing, and I called the doc, I made an appointment, I said, hey, you gave me this medication, my ear is ringing. If he or she is saying, oh, just, wait a few days and see what happens. 2 days down the road, my ear is still ringing, I go back. Okay, at that point, the patient has to make a choice. Am I going to continue to go to this same person, or am I going to go to someone else and stop that medication, because obviously I'm having a reaction to the medication.
An adverse reaction to the medication, yeah. And we have to be confident enough. Now, we don't want anybody to put themselves in harm's way.
No.
But if something is, for an example, I was on a medication, and it was coming out of my skin, and I had skin, like spots on the side of my face. Well, stop.
Yeah.
It was like it was burning. It was like, what in the world is this?
Yeah.
So I was having some kind of reaction to it, so I had to use some common sense.
Yes.
I got to stop.
Yes.
Until I sent the information in, until I had the visit. But in the meantime, I had to
make a choice.
I had to use
Make
my
a
common
choice.
sense.
Make a choice. And one of the things I tell people, when you're having a situation like that, the first thing you want to try to do is what I call flush your body out. Just drink, get yourself a lot of water, and make you some herbal tea. Just flushing your body out, because once you start having that reaction, you need to get that stuff out of your body. Because no matter what the medication that it was given to you for, it is causing an adverse reaction and causing a bigger problem, because now whatever the medication was for is not taking care of that problem, or it's causing a worse problem.
Yeah.
So you want to flush, make sure you're drinking lots of water, get some herbal tea, get yourself flushed out, make your follow-up appointment. And sometimes you can just make that phone call and they can call you in something else.
Right.
But what I want people to do is to speak up.
Yeah, and get it out of your system. Hey, also Brooks from Memphis, Tennessee. Hey, and Carol Velasquez Richardson.
Yeah.
Oops, I just dropped my phone. So, also Brooks, are you still riding your motorcycle? So, talking to Stephanie Pollard, who is a research scientist, just a wealth of information for us about this body, this vessel, the first gift that God gave us, and then some breath into it. So it is our responsibility to help take care of it. This is the season when a lot of people will getting sniffles, and we don't want you getting colds and flu and pneumonia or any of that kind of stuff. So what are some precaution things that people can do? We know that we need to be conscientious and wash our hands. But what are some of the other things that people can do to help offset what seems to be the seasonal kinds of things that we get?
Well, one of the things is vitamin C, and the other one is called echinacea. Those are vitamins that you can take, and I know Walgreens has it. It's in a little pack, and you can put it in water. It's called Emergency, and it's got like a combination in there. And what you just want to do is during this time, just boost up your immune system. Just because you're hit with the elements. I mean, it is what it is. The temperature is changing. You know, you got other people that have colds or have the flu, so you're going to be in contact with them, and more people are coughing and sneezing during this time. You got more kids that, you know, are out and their hands are on everything, and then you're touching everything. So washing your hands and being mindful as much as possible to not put these hands up to this face, especially when you're out during the day, because you're just touching stuff. So you're out there touching stuff. Keep this out. Keep this down.
So Stephanie, now my mother would tell us, don't go outside with your head wet.
Mm-hmm.
Now there are other people who say that going outside with your head wet, or my brother Lindsey Jr. would get up at 5 o'clock in the morning and take his bath so that he wasn't going outside freshly out of the shower.
Mm-hmm.
Which seems completely extreme for a lot of people because we barely get up in time to get the shower, and so we're running out the door. But does that play a part in our bodies being receptive to cold and flu kind of viruses? The fact that our hair is wet and our body is damp, is that an old wives' tale, or is there?
Well, part of it is your body throughout the day, your temperature, your thalamus is the temperature gauge, and it what I call turns on and turns off.
I just want to make sure we could hear you.
Okay. Did I move?
Yeah.
Okay. And so throughout the day, your body is adjusting to, is it cold, is it hot, is it cold, is it hot? It's just like if you're exercising and you're sweating. The reason why you're sweating is because your body is warm inside, and that sweat is cooling your body off. And that's needed, because people that don't sweat, there's a condition of some people that they don't sweat. They have to monitor their internal body temperature, because that sweating causes your body to cool down. So throughout the day, your body is going through hot, cold, and it's normally taking care of itself. But when you have a situation where you are wet, say if you got caught in the rain and you didn't come home and take off those wet clothes, you need to get off that wet clothes and get yourself dry. It's the equivalent of taking a shower and, you know, just jumping right outside. Now here in Florida, you know, we are more warm, and during the summertime, you know, we may have 75 degrees in the morning. But as it gets cooler, your body is going from having that hot shower and your pores are open to you going outside and it's 50 degrees. Now your pores are constricting. So now your body is going from hot to cold, and your body is having to adjust for that. And what just happens, it can affect your immune system. And so across the board, when your immune system is affected, anything you get is going to be more prominent. You know, be it a cold, be it your sinuses acting up, be it that you know, you're just coughing and can't get rid of it. When your immune system is down, anything can be prolonged, because your immune system is, what I talked about, is constantly fighting off stuff all through the day.
And you're more susceptible to receiving something because your body is in the process of doing all of this adjusting.
Mm-hmm.
And we don't even think about that. I mean, boy, yeah. This is an incredible.
So that emergency during this time, your body's immune system may be a little bit lower, just because it is fighting off more things, like I was saying about coughing, sneezing, kids, and all of that. So taking that emergency with the echinacea in there, the vitamin C, that just boosts up your immune system, you know.
I'm on a regimen of vitamin C with rosehip.
Okay.
And another vitamin C with something else in it, just to help strengthen the lining of my lungs, you know, so that I can stay healthy and fight anything that comes through. Hello, Cleo there. Talking to Stephanie Pollard, who is a research scientist and health educator and a regular contributor at the Wellness Radio TV on her show called Health and Wellness Today. In this season, we're talking about arthritis, the infected fluids that can be in your joints, in any part of your body, our sinuses being more receptive or more prone. We turn the heat on, the air gets dry. So you really, really need a humidifier. Stephanie has recommended putting either some Vicks or peppermint oils in your humidifier just to help open everything up. And this is a time, and oh my goodness, that great piece of advice of keeping your hands out of your face, and then particularly in your eyes, Stephanie.
Yes.
Tell people how prone the eyes are to pick up.
Because that's what we call an open space, because your eyes, that's just, everything is open right there. So when you touch it, it just absorbs right into your skin, because everything around your eyes is like what we call soft mucus tissue, or soft tissue, and it's moist. And so that's what bacteria likes. Bacteria likes moisture, a dark place, and heat. And so when you're putting your hands in your face and around your eyes, you got moisture, and once it goes past your eyelid, you got a dark, moist, heat place, because your body naturally is warm. And so the same with your mouth, or even around your mouth. That's all, mucus. Not mucus, but moisture and soft tissue.
Yeah, so the eyes, sometimes this time of year in particular, just keep you a Kleenex handy if you need to dab your eyes, so that you're not having to wipe your eyes with your fingers, because you touch things, you touch other people, you touch doorknobs. When you even go to the restaurant, you have to pick up the Louisiana hot sauce or ketchup or whatever. They wipe the table off, but they don't wipe those bottles off.
No, they don't. And then here's my other thing. We call it in the lab a fomite. A fomite is any animated object that has constant touching with it. Like, for instance, when you go to the bank and you have to sign, or you go to Starbucks or go somewhere where you have to sign your credit card statement when you pay for something. That pen is a fomite, because it sounds kind of gross.
Fomite, yeah.
Because we don't think about it. Now people might be more conscious of it, but there are a lot of things that you touch throughout the day that multiple people have touched.
And then when you put your hands in your face, in your mouth, in your eyes,
It's
you
the
have the
equivalent.
potential of them putting their hands.
It's just like them sticking their finger in your mouth, because I see people. Just because I work in healthcare, and working in healthcare, they always, especially during this time, they always talk about washing your hands. They talk to you so constantly about being mindful of where your hands are. They, putting on your gloves, making sure you're taking off your gloves, making sure you're washing your hands in between your gloves. So hand-wise, in healthcare, they constantly drill you on it, and especially during this time, because that's the biggest thing that transfers germs.
Yeah, because we're using our hands, other people are using theirs. Great information today. Stephanie, I really appreciate you doing this bit to help encourage us to do what we need to do to stay whole and healthy during this season. We're approaching Ho 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 Day, Christmas Day, so we want to be in good health as we visit with our family and friends, or just chilling, enjoying ourselves. You don't want to be chilling because you're sick, but just because that's what you elect to do. Stephanie Pollard, who is a research scientist and health educator and a regular contributor to Health and Wellness Today show here on At the Wellness Network. We hope that you will continue to join us for this weekly segment talking about this vessel, this body. Drink, 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 lots of water. Lots of water. As a matter of fact, it is advised that you drink half of your body weight in ounces of water, because this body is 70 to 80%
water.
And so we want to put in it, you don't take a shower in those other beverages, right?
Nope.
So let's let's cleanse ourselves with some good water. So
Yeah.
Stephanie, we look forward to next time.
Yes.
And we hope that if you have any questions for Stephanie, if you have any topics that you would like for her to cover, please list those in the comments section, and we will be sure to do a show on those topics, because we want you to be well educated about your body and feel comfortable when you're talking to your healthcare provider about what needs to be done and how you can take care of this vessel and live a
Yes.
whole healthy life harmoniously and everything working the way it's supposed to work.
Yes. Thank you.
Thank you all. Thank you all so much for watching. We will see you next time. I'm Pamela Coons at the Wellness Radio TV. Remember, there is healing at the well.